All right, welcome back to part 2 of the lateral elbow pain series. In this video, I'm going to be going over desensitization of how to reduce that discomfort. The first section of this video is going to be desensitization. Let me show you a few things that you can do to help improve the sensitivity in that area. The first thing that you can use is a tool like this. A vibration tool, a muscle percussion tool, whatever it is that you have that you can apply on that muscle that can provide somewhat of a massage. This is a muscle percussion tool that we like to use here in the clinic, and here's how you use it. So with the setting, we like to put it on setting number 1 just to start, because it's a little sensitive in that area and it seems to be a little more tolerated here in the clinic. So what you do is you're gonna take this tool and place it right on the outside, right on that discomforted area where it's sensitive. And you're just gonna work slowly down the arm and then work your way back up. You're basically covering every inch of skin on the outside portion of your forearm. You're just gonna slowly repeat all the way up and all the way down. If you find an area that's sensitive, go ahead and spend a little bit more time on it. Try to desensitize it. I'm not applying a ton of pressure here. I'm just using the weight of the tool. Obviously, when it starts bouncing off there, that's a bone. You kind of want to stay off of that. Then what you do is work towards the front portion or the inner portion of your forearm. Same thing, I'm not applying weight to the tool, and I'm just working the tool all the way up the forearm. So that's how we use a muscle percussion tool on the outside portion and inside portion of the forearm to help reduce that sensation of pain or sensitivity you may be having. Another option to help you with that sensitivity is to use a cupping tool. They're easily found online. It looks like this. It's a suction cup that allows you to suction up some of that tissue and then manipulate it and try to find target areas that may be causing some of that symptom. These are all techniques to help improve sensitivity, and it's all done to your tolerance. So in order to use this tool, I'm gonna need some type of lotion or something to reduce the friction on top of the skin. My preference is to use the MERAKI CBD Pain Relieving Cream. I use this because it has shea butter and then it also has the CBD in it, which allows me to have some of the healing properties of the CBD, but then also it's not too slippery as I'm sliding around on the skin. It allows me to suction up the skin and apply traction and pressure all in different directions. So let me show you how I do this. Okay, so I'm gonna use a bit of my cream here. I'm gonna rub it right on the top side down the outside portion of my forearm. So getting all in that area that you're having that sensation of pain or sensitivity. Now what you do is you're gonna take that tool, you're gonna apply it right onto the area that you're having that discomfort. You're gonna suction it there, and can you see how it lifts the skin? So it's giving the suction, and then I'm just gonna drag it all along my forearm, trying to find areas that may be sensitive, maybe a little discomforting, just trying to reduce some of that sensation of pain. And you just work back and forth all along. There's no real way, oh, you've got to go counterclockwise, clockwise. It doesn't matter. It's all the same. Just get in there, apply some of that suction, and just work your way around the outside portion of the elbow. What this does is help improve some of that sensitivity. Sure, are you gonna be a little sore after doing a little massage or using the tools and things like that? Yeah, it's expected. However, the soreness shouldn't last more than about a day, 24 hours. And it shouldn't be excruciatingly painful after. If you're running into that kind of thing, you might wanna tone it down a little bit. Maybe not add as much suction or not as much pressure, things like that. Or just cut down the duration of time, maybe that's causing it. Usually do this for about a minute or two, help reduce that sensitivity, and you're gonna work your way all the way up and down that outside portion of the forearm. So that's how we use a suction cup to help improve some of that sensitivity. Another option that you can use, grab a lacrosse ball. So I like a lacrosse ball because you can still use some of that lotion or CBD cream or whatever cream you choose, but this allows you to find that area and work along that muscle, just as you were using the suction cup. So you already have that lotion on there to reduce the friction, and then you just apply pressure and just work all along those muscles on the outside of the forearm. So right now, I'm holding my shoulder up. It's causing a little fatigue up here just because I'm showing you, so I don't recommend holding it up like this. What you're gonna do is rest it down on your arm, and then you can work down in this manner. It's a little easier to perform it without all that exertion of holding your arms up trying to make that happen. Once you've worked the outside for about a minute or so, you can work into the front side. Same principles apply. You have the lotion on there, you just find any of those areas that may be causing you some of that sensitivity. Here's the fourth option, good old-fashioned manos. Your hands. You can use your thumbs, your knuckles, all of that to replicate what we were just doing with the muscle percussion tool, the suction cup, the lacrosse ball, all of that. You're just gonna use your hands. So you can use your fingertips to work into the muscle, applying a little bit of pressure, and then work your way down towards your fingers. Yep, just like this. You can also use your thumb and just slide all the way down, trying to add a little bit of pressure to help improve the sensitivity. Let's set some expectations regarding using these interventions to help improve the elbow pain. Number one, this is a short-term fix. This is not that long-term preventative type treatment. Usually massage, cupping, hypervolt, all of these fancy things that people are using are typically used for reducing the sensitivity so that the client or person who is needing this kind of intervention is able to perform more corrective things. Maybe they need some modification to their movement or activity that they're doing. Maybe somebody needs a stretch because those muscles are extremely tight or limited in length. Or more importantly, what if those muscles cannot handle the load or the demand that the person is putting on them? The way we improve that, and I would say that is more of a long-term fix in improving the tensile stress of those muscles, and that's a strengthening program. So we'll definitely get into the strength portion regarding the elbow pain, so that'll come in another video. But for now, that expectation is this type of intervention is short-term and used to help reduce the sensitivity. You can also use ice right on that area, 20 minutes. It should also help improve that sensation of pain. Heat does the same thing. It's not about the inflammation portion or any of that. It's really about what your body responds best to in helping improve the sensation or sensitivity of pain or discomfort. Just another disclaimer, this is not medical advice. These are the things that I do here in the clinic with some of my clients. It has been helpful, but I highly recommend that you be evaluated by your medical practitioners and your medical doctors so they can assess you and find out what truly is going on if you're having that outside elbow pain. But nonetheless, this is for educational purposes. So if you're looking for a few of the tools that I used here in this video, including the muscle percussion tool or a lacrosse ball or even the CBD pain cream, I do have some here in the clinic available for you if you're in the California area and local to me. If not, I do have an affiliate link down below regarding a muscle percussion tool, a lacrosse ball, but regarding the CBD MERAKI pain cream, this is something that I cannot have an affiliate link for, and I only have it here in the clinic. So I hope this video series is helpful. I will also see you in the next video.